Dr. Frank Arabi. You know, like sometimes we forget to say the word doctor to people we know. So I should give you your respect, your title, Dr. Frank Arabi. Thanks for joining. Thank you for accepting this invitation and for having time with me here today. I'm looking forward to ask you a lot of questions around the medical field and some other things. So before I give you time to speak, I should rephrase again and say what we are doing here in this session. So I've been thinking of starting something like this called Career Dynamics Talk, because every time I talk to people, I realize they have some issues thinking about their careers. Like some people, they don't know where they're going, they're not satisfied with what they're doing, and some people they're questioning, they're asking themselves like, "Is this the right choice? Should I change the path or something?" So I said, okay, let me find some time to talk to people I know, friends I know, and also people I don't know, so that I can get different perspectives. And maybe this is going to be helpful to someone who is thinking about the same things. So that's why I called it Career Dynamics. And the session today is called Blame It on Ben Carson. So because I know you're a medical doctor, I'm a pharmacist, we kind of in the same field, not the same like exactly, but like it's around the medical field. And we know that when we were making choices to come into this path, there are some influences from parents, from books, from Ben Carson. So, and these people are like, yeah, go to this side because yeah, it's good, you get some money, and then we later on came to realize maybe it's not that exactly that how people used to tell us. So that's why I wanted today to have some time and talk to you, because you're a young person, you are energetic, you are doing fine and very well in your career, and also some other things which we discuss about. So that's why I said, okay, let me talk to Frank and see what he's going to tell us today. So thanks for coming. And before me, because sometimes I happen to talk a lot, but I know this session should be more of you talking and me listening, or maybe asking some questions. So take your lead right now, introduce yourself and tell us what you're doing, and then we start from there. Welcome.
Thank you very much, Josephat. My name is Dr. Frank Arabi. Currently, I'm working at CCBRT Hospital here in Dar es Salaam. CCBRT is one of the largest provider of disability services here in Tanzania. So we have a hospital, which is a zonal designated hospital located here in Dar es Salaam. And there I'm working under the orthopedic and trauma department for the past 2.5 years. But also I'm studying at the University of Dar es Salaam. I'm my Masters of Arts in Project Planning and Management. So almost heading to almost heading to graduation. But also I am an active member and also a leader in the Medical Association of Tanzania, MAT. And previously I used to be an active member and a leader as well for Tanzania Medical Student Association back in the year 2019. I was a president there in the year 2019 until 2020. I would like to congratulate you, Hema, for Josephat, for starting this session, because really there's really a challenge on how these our young sisters and brothers are being guided on the while they want to pursue medical field. And there are also, of course, there are also many studies looking into this area. Maybe we'll get a chance to talk about them. But I think it's a great project, and it will be an eye opener for many people who aspire to go into medical practice. And I'll be happy to share my 1 or 2 cents in this session. Thank you.
Thank you so much. Such a strong CV so far for a young guy like you. Congratulations. I mean, I know you somehow because we stayed in the university for like 4 years. We came across in different issues, and I'm so happy to see that you are doing very fine right now. And there are some things I didn't know. I didn't know if you are. Oh, I know that you are doing a master's, but congratulations that you're about to finish. And maybe there is a question from there. There's a question because why project management? Well, I mean, I know many friends of mine who are medical doctors, but they have decided to specialize. I think I'll ask you that question later. I'll ask you. So before I get there, I should introduce myself as well because I forget sometimes. I'm assuming people know me, but I don't want I don't want my introduction to be long. I'm a pharmacist, everyone. I based in Moshi. Maybe there's some time when I'll talk more about me, but for now that's enough, I guess. Um, so let me first of all, before I get to ask you why are you doing Masters of Project Management, I just want to know your short story about how did you become a medical doctor? Like what influence was there when you were trying to think about what to do for your career?
Thank you very much, Hem. For me, the passion for to be a medical doctor started very early when I was very young. I had that feeling of wanting to help people. That was in me. I always wanted to take care of people. So that started when I was very very young, and to the school where I was studying back in the secondary school, I used to love so much the biology subject. So once my biology teacher told me that, and I was doing well in biology. So my biology teacher said that you should go and be a doctor. So started it started when I was very young, at home and stuff, and then at school I happened to love a lot biology. I used to hate mathematics for sure. So going to high school, I opted to take science subjects, which would eventually lead me to go and be a doctor. So I can say that my teachers during my secondary school also played a role to direct me into medical school. And of course, when I was in secondary school, at my school, we had a program where the alumni would come and give inspiration and career guidance to the students every year. So some of our brothers who were I studied in a boys all boys secondary high school. So our brothers used to come there to inspire us, and so most of those top brains, who we used to respect, and they were the high performers, all of them went into medical school. Some of them uh, pursued pharmacy, and some of them pursued medicine. So when they came back, they inspired us a lot to go into medicine. So, and eventually I ended up getting into medicine, and of course I ended up enrolling into the university where these brothers were studying as well. Yeah.
So you want to tell me that you never came across Ben Carson at any point?
That I reserved the best for the last of this
The
question.
last.
So
Okay.
me like many other doctors here in Tanzania, or medical students here in Tanzania, we were so much inspired with Ben Carson. I remember when I was in high school, like first semester in high school, I watched no, it was just after finishing my ordinary O level secondary school. I watched the movie on Ben Carson operating the two kids, the Krimepagas twins.
Yeah.
So, at that time, the Gifted Hands book and the Ben Carson movie was a big thing, for any biology student, any student who was doing science subjects wanted to become a neurosurgeon. Even for me, it was my dream to be a neurosurgeon. Of course, I will tell you what happened until now. I'm taking another route, but yes, Ben Carson, the Gifted Handbook, and the Ben Carson movie played a very big role to inspire me going into medical school.
Okay, okay. So, I mean, later on, I'll ask you if we have to blame Ben Carson or not. But thanks for that short story, which is like maybe similar to most of us. We've been listening to people around us. We've been listening to friends, people who are a little bit ahead of us, and then that's when we decided, okay, this is where we're going. But there's a study here. I know there might be some studies in Tanzania, but this is in India, and so let me try to summarize some of the findings here. So the title is Choice of Medical Profession, Passion or Pressure, Medical Students' Perspectives. And it's very interesting that the number of participants for this study were medical students. So medical doctors, young medical doctors. So it was 1,060 MBBS students and practitioners throughout India. So the most interesting finding is 60% of people said that they went into the medical profession because of passion, like 60, which is not a bad number. It's about 50, but thinking that 40% of people, if it's 60, went out of passion, so 40% of people went there without passion. And the reasons, most of them is pressure from parents and some other people around. So you find that 40% of people went there because of some other reasons apart from passion. And then at the end, they ask a question if they do regret, and found out that 32% of people regret getting into the medical profession. Now, this is a noble profession, we know. And we think that for people to work in this field, they have to love it and do it in a professional way, in a way that they can serve people, they can help people, they can give the best, right? So now, as we see the numbers, maybe you have some findings in Tanzania, but as we see these numbers, we start getting concerned, and we see some people who are now starting to drop and they don't practice anymore. They decide to do some other things, maybe around the medical field, but doing some other things, or even out of the medical field. So let's maybe get to this question and ask ourselves, like, what is happening? And probably maybe we can also think, like, what should be done? So let me give you a chance, because I mean, I remember I saw you one day participating in a Twitter conversation. I saw your comments. So this is also one of the reasons as why I said Frank is the right person to talk about when it comes to this topic. So welcome.
Yes, thank you, Josephat. There is a problem right now, and we can't stop talking about it. Many students, they are quitting medical school, and of course there is a study here that was done here in Tanzania. It was done by Dr. Sirili from Muhimbili University and colleagues. So they looked into the how they researched the medical student and if they would be practicing clinical medicine in the future. Surprisingly, more than 50%. The study concluded that more than 50% of medical students enrolled between 2011 to 2015, I think, or 2020, they will not be practicing clinical medicine at all in the next 10 years, I think. So you can just go and check more in that study. And that is what we are seeing here as well. So if people are quitting clinical practice, so if they are not quitting clinical medicine, they are going away. They we say the brain drain. They don't want to practice it here in Tanzania. Many of them. And so the reason for quitting are quite many. And I don't want to go so much deep, but I think most of it's because of the whole system which we have right here. You know, also the fact that studying medicine give you a chance to go into you have that chance of going into different fields. So currently, so many people, they don't want to practice clinical medicine. The main reason is because of the low pay. Number one is low pay, and number two is the difficulty working conditions. And so as I said before, another thing is because of the how we have our healthcare system is structured. You know, here, for example, in hospital setting, you have hospitals which are under Ministry of Health, and you have hospitals which are under a separate ministry. So that's partly is also part of the problem, because so many people, they don't want to go work in facilities which are under the local government, because there, of course, because there are quite different benefits working with the hospital and the Ministry of Health and under the local government ministry. So and many people, as per population in our country, many people are found in areas of closer to these facilities managed by local government, and there is where people, they don't want to go to practice there. Many want to practice in big hospitals because of the salary there is good, the working environment are good, so that's part of the problem. And of course, also, many people also are going into public health because and other and public health and research because I think many they see that they going there they get job satisfaction. Of course, also they get a higher pay compared to clinical practice. So it contributes a lot to people moving out of clinical practice. And I think another thing which is coming up currently is the issue. I'm not sure if you have seen it, Josephat. The issue of employing doctors and pay them half the amount. So in a system where the already current uh, salary is quite very low, and also you imagine they are employed and being paid half that amount. So currently, many people they studied medicine, but they go to business. Some of them they go to clinic, they go to public health and research, but others they don't want to practice medicine at all. They just go to do MBAs and start their own businesses, which is very alarming because I know some of my friends who were very bright and they should make they could make it a being a very good doctors. Currently, they don't want to practice medicine at all. So we are wondering where are we heading in the future? Because we are the patients of the future. We need to do something to change the situation. Yeah.
Yeah, I mean, I can understand as a person who has actually worked in a hospital setting, maybe not for a long time, but I've seen how is it hard to work in a hospital. Like the workload is huge. You're actually risking yourself because you're actually working in a place whereby you can easily get infected. And I see like people working overnight, sometimes without even being given extra pay. So it's something that is not easy. And I don't know, me and you, we understand this. Maybe some other people don't understand because they've never been part of it. But I'm just thinking, what can we do? Because we are seeing this is happening right now, and it's even getting worse. People are now getting paid half of what like normally they could be paid, which also can be another reason as to why people not be practicing maybe very well or dropping. And maybe I think Tanzania is one of the countries which don't have like this recommended WHO patient to doctor ratio. I mean, it's very, very low. So if we are getting into this challenge right now, so we are risking many people. It's getting worse. So what can we do? Because I think that we have like the authorities which can do this, and I'm just trying to ask myself, don't they see this or what is happening? What do you say about that?
Yeah, thank you, Hema. You have spoken about a very important issue. I think currently our doctor to patient ratio stands at one doctor per 20,000 patients, which is way below the WHO recommended. And now the problem is, I think this problem is more of it is complex, but and it needs a holistic approach in tackling it, all the way from admission of students into medical career, like when they want to go to university, the admission criteria should be well revised, and also uptake of graduates. Some for someone who studied medicine, it's very even if you graduate, it's very hard for you to go and self-employ yourself because opening a hospital, it's a huge investment. It requires a huge investment, which is very difficult for someone who just graduated to go and employ himself, compared, for example, to maybe to a software programmer who can just start doing some online projects while maybe sitting at home. So I think even for the uptake of the graduates, we should really consider reconsider our structures on how we can streamline the recruitment protocols. Because as of current, there are more than 3,000 unemployed doctors on the streets, and partly it's because of the past 5 years. during the tenure of the late President Magufuli, the uptake of the recruitment of doctors and other cadres were very, very low. I think for the past 5 years, only like less than 1,000 doctors were employed, and every year your universities is more than 1,500 students are graduating. So you accumulate for 5 years, you accumulate closer to 5,000 graduates, and you employ only 1,000. So you're creating a big gap of unemployed and demotivated, unmotivated doctors on the streets, which is very dangerous. So all the way from checking the admission protocols to uh, creating, as I said, to like absorbing these graduates into working in the hospitals, we should also consider adding incentives in periphery hospitals. Most people, they don't want to go to work in dispensaries and rural hospitals, because you are being allocated there understaffed, you overwork, and then you are paid less. I think the government maybe should add certain incentive to people who have to go and work in the on the villages. This will uh, add a motive for many people to go work there. As you know, 70% of Tanzanians, they live in rural areas, and the
Yeah.
doctors, they don't want to go to work in rural areas. So adding incentive there could be a motivating factors for doctors to go and practice there. Yeah.
Yeah. So I agree when you say that it needs a holistic approach, because there are so many things. Like some people have been arguing, saying that, like being a doctor or a medical practitioner, it's more of a service, not of a business, because there's not so much money coming out of it. So there's something about the funding to be increased and a lot of other things. So as you have said, and I guess that because me and you and some other people around us, we know about this. Maybe it's a high time right now we should have like one voice and try to reach the respective authorities which can do something about it. You never know, because people are saying about it, but I think it's high time that now we should be pushing, maybe in a more peaceful and diplomatic way, to the right authorities, so that you can see if we get solutions out of this. And I believe it's very possible, because our government is very, very listening government. Yeah. So I think
Yeah,
I'll just
that's
stop
very.
there. Yeah, proceed.
Yeah, I just wanted to comment a little on this. I think that's very correct, Josephat. As you know, like 2 months ago, Benjamin Mkapa organization, they hosted the first national human resource for health conference, and the conference was graced by the president of Tanzania, Her Excellency Samia Suluhu, and the Ministry of Health was there as well. So all these issues were discussed, and the ministry started now to brainstorm more on how to to tackle this challenge. So as you said, we should voice up our opinions, and it's good to see that the ministry is very actively listening to the young people and engaging with the young people as well. And now we see that we have the National Conference on Human Resource for Health, where these issues are being discussed. So I think we are heading to the right direction, and I believe in the future, this issue of people not wanting to do clinical medicine will be solved. I believe it will be solved in the future.
Sure, sure. Hopefully, fingers crossed. And now I just want to ask you a quick question. Is that a reason as to why you are doing project management and not specializing?
It's part of the reason, but since when I was in medical school, as I said earlier, being involved in the Tanzania Medical Student Association, we were doing many projects. So I had that what I can say. I had that early that early exposure on project management as a student, and then slowly I developed that passion of now going to the project side.
Okay.
Good enough, the hospital where I'm employed, there are so many projects as well. So then I said, okay, after I planned to practice for a couple of years, and then that was my plan, to practice for 3 to 5 years, and then to go straight into projects. So yeah, true. It's what I said earlier about the current frustrations in the clinical practice are some of the reasons why I moved into projects, but the big part is because I had already previous exposure to managing the projects. Yeah.
Okay, okay. That makes sense, and I'm glad that things are like falling into place, because at some point we need some diversification when it comes to our professions. Like it's good if we have a doctor who can do project management, so that we know that in that area we have somebody who is like can work comprehensively and kind of do all these things together and make things okay. So I think everything is fine with that. I don't see any problem. I know we'll be missing a very talented doctor in that area, but I believe that on the other side, you'll be doing like the area of project management in the medical field, and that's something which is fine as well. So, unfortunately, time flies so fast when we have so many things to speak. And I'll just ask you another question. Maybe let me ask you: should we blame Ben Carson at some point? Should we blame Ben Carson? What do you think?
uh, as the title of this talk said, we should blame on Ben Carson. I think we should blame ourselves. We should not blame Ben Carson.
Okay.
Yeah, Ben Carson did his part. He inspired us very, very highly back in the days.
Mm.
And I think even ourselves, we should not blame ourselves, but we should come with the strategies on how to move forward. Which
Yes.
is why I congratulate you on starting this something like this, the career dynamics talk, because the student who will hear this will get to now to have a bigger picture of what's happening in the clinical practice. So yes, having talks like this, conferences around inspiring medical students on how they can choose well the field they want in medicine, is really something we should push forward and reach these students. Yeah.
Okay, thank you for that. Now I have a question, Frank. I knew you as a pioneer of FarmLink, which was actually a digital innovation project around pharmacies, connecting pharmacies and making sure that there is information flow from one pharmacy to another, and pressing of orders and delivery and all those kind of stuff. But my question is like, where is family right now, and which part are you playing? Because for sure, I saw this. It was, is it 7 years ago, 6 years ago, I think. It was something which was so promising, and I was really looking forward to seeing it, like getting into real practice. I see some other projects right now around the same thing. So I would like to ask if that is something you're still working on, or you have not, you have stopped working on it.
Yes, thank you, Josephat. So currently, I'm not part of FarmLink. I exited the team like 2 years ago, but my colleagues, they are still working on it, and they partnered with the, I think when I was leaving, it was we were on the blink of partnership with a certain company from the Netherlands. So my colleagues are still working on it, but me, I'm not. Past 2 years, I exited the team to pursue other areas.
Okay, okay. I understand. I mean, I think we also sometimes we need to understand that things change. We get new interest.
Yeah.
We get into new interests. As I said, you get into new. I mean, it's a step, like one step after another. And there's a friend of mine. He told me like every time you have to know that there should be an exit plan. You'll never be doing something for forever. I mean, there are some things you can do
Sure.
for a long time, but sometimes you have to allow growth. It's like you are in the steps of life. At this point, you're doing some things, and they make you this person who can do some other things and some other things. And it's a good thing to live and let some other people do something, because we can't like do everything all the time. So I understand that. And honestly, I just want to congratulate you, because you are one of the people who thought about it in Tanzania, I would say. And then later on, some other people started doing something which is similar. And we see that there is so much which is being done now in the medical field, in the pharmacy field, to be specific. And I would say that that was a very good thing that you thought about it. And I believe, because now you are doing something which is related to project management, so there's so much of innovation and creativity which will be coming from you, and I'll be looking forward to seeing what you're going to do next.
Thank you.
Yep. So we have 1 minute remaining. And I don't know, maybe there's something that you want to tell people who are considering getting into the medical field so that they can have something to think when they are getting into this path, or people who are already studying medicine so that they can learn something about this.
Thank you, Josephat, for this opportunity again. I think for people who are currently in the university pursuing medicine, they should really think about where they want to go prior to graduating. And for students in high school who wants to go into medicine, they should seriously consider talking to people in the field in which before they decide to go into medicine. Yeah, because it's a huge decision to make, and
Yep.
they should be very well informed before making this decision.
Just having the right mentors, the right people to listen to, right?
Yeah, correct.
Yep. Frank, it was nice to meet you. I mean, this was very good. It seems short. Maybe we'll find some other time next time. Thank you so much for your inputs and everything, and may God bless you. Have a nice weekend.
Thank you, Josephat, for having me. And I say again, I congratulate you for starting this, and looking forward to seeing other topics going forward. Thank you very
Thank you
much.
so much. Thank you so much. Bye.
Bye bye.